Welcome to the Virta Health webinar. This is CEO and co-founder of Virta Health, Sami Inkinen here. Before we get started, again, one more reminder, if you have any questions, you can either click the Q&A on the Zoom screen, or you can email to Julian Weiser, julian.weiser@VirtaHealth anytime. I will see those questions and I will try to answer either during or at the end of the presentation. So welcome to the Virta Health webinar. I think we have almost a couple of hundred people calling in today, so thank you so much for joining. Briefly, what is Virta? Virta is the first treatment to reverse type 2 diabetes sustainably without medications and surgery. And I will cover at least three areas today during this webinar. One, I will briefly discuss the type 2 diabetes epidemic. Then two, I will cover the peer-reviewed outcomes of the Virta treatment. And then three, we'll go into how does Virta work and what is the patient experience. And then four, and lastly, I'll explain how we have worked with health plans throughout the country as well as employers, and then finish off with a summary. Again, if you have any questions throughout the presentations, feel free to ask me anytime. I would think the presentation will take about 30 or 40 minutes, and then we should have plenty of time to answer questions at the end or during the presentation. But before I go into that agenda, let me talk briefly about my background, because it explains why I co-founded Virta and explains our science a little bit. So here's a proud picture of myself winning the world championships in triathlon in my age group a few years ago. And I say proud because all triathletes like showing pictures of themselves in spandex. So surprisingly to me, despite being in a pretty good physical shape, I found out that I was pre-diabetic while performing very well in triathlons. And obviously this was a shocking realization to me, because anyone who is struggling with pre-diabetes or type 2 diabetes, we tell these individuals to do two things. One, lose a little weight, and two, introduce some exercise into your life. And obviously I was doing both to the extent you could do, and I still had pre-diabetes. So I personally started asking questions, how is this possible? And I discovered three things which really led me to then co-found Virta in 2014. One, indeed, you can be skinny and pre-diabetic or type 2 diabetes, because it's caused by insulin resistance and not by obesity. And two, you can actually reverse insulin resistance without exercise, without dieting, or without substantial weight loss, using this kind of a tool called nutritional ketosis, which I'll explain later. And then three, in order to deliver this type of somewhat revolutionary intervention or treatment, you actually need to deliver medically supervised care on a near real-time basis, which really is impossible with the today's go and see your doctor type of care delivery model. So I discovered those three things, which led me to team up with the scientists who I learned all this science from, and found Virta Health in 2014. And now, about 4 years later, we are pretty far on our mission to reverse diabetes in 100 million people by 2025. So that's a little bit about my background. And before that, I should mention I've been a technology entrepreneur all my life. I started a company called Trulia. So if you've been interested in online real estate, you may have used the service Trulia or Zillow. First, let me briefly talk about type 2 diabetes in America. This may not be surprising to you, but me having pre-diabetes a few years ago, I wasn't alone. Today, almost 40% of 4 in 10 American adults have pre-diabetes. And about 1 in 7 or 13 or 14% of adults have actually a full-blown type 2 diabetes, which is a pretty shocking number. So if you just do the simple math, more than half of American adults have either type 2 diabetes or pre-diabetes. Probably not many of them are triathlon world champions, but clearly I wasn't alone with the pre-diabetes that I had a few years back. The obvious question is, how is it possible that half of adults are struggling with a chronic disease or are on their way to this chronic disease. One of the reasons is the kind of food we are putting into our bodies. And what I have here on the slide is a Time magazine cover from, I think this was early 80s. And really for the last 20, 30 years, we've lived a time when we've demonized cholesterol and fat, the basic message being, if you don't eat fat, you will avoid heart disease and you're effectively eating healthy. And the point I'm making here is specifically in 1977, FDA concluded that a healthy diet is a diet that includes a lot of grains, lots of carbohydrates, and very small amounts of fat and practically no saturated fat. And so these guidelines were introduced in 1977. And you can see here on this chart on my screen, soon after that, the obesity and type 2 diabetes numbers started skyrocketing. So one of the key reasons why more than half of Americans today have either type 2 diabetes or prediabetes is for the last 3 decades, we've promoted an extremely low-fat diet, and consequently people are getting most of their food calories from carbohydrates. You may wonder, is that what I was doing? Absolutely yes. I was not putting any kind of fat into my mouth for perhaps 20 years. I was able to out-exercise the calories I was eating, so I wasn't gaining weight, but still I was able to produce prediabetes. So how big of a mess do we have? This may not be a surprise to you. The cost of diabetes in America is more than $300 billion a year. If you are a self-insured company, benefits leader, or if you are an insurance company CEO, CFO, chief medical officer, you are paying this party, this ridiculously expensive party. And type 2 diabetes obviously has become a massive, massive industry. And obviously the numbers of people having prediabetes or type 2 diabetes have been going up aggressively. But in addition to that, the unit cost of treating or managing these type 2 diabetics has also grown rapidly. One example of that is the unit cost of insulin, which is one of the late-stage type 2 diabetes drugs. You can see here on my slide, over the last 20 years, the unit cost of insulin has increased about 1,300%. Again, if you are a benefits leader in a self-insured company or insurance company executive, you are paying most of these bills. And of course, some of this is paid by individuals living with type 2 diabetes. So what can we do? Can anything be done when numbers are just going up and up and this epidemic is now touching more than half the Americans? I'm posing a question here for you. Given this epidemic, if you had access to a new treatment that could systematically reverse this disease, type 2 diabetes, get patients off of diabetes drugs, including insulin, in just a matter of weeks, and sustain these results for a number of years, and save nearly $10,000 in the first 24 months alone in medical costs, and you would know that you would only pay if these results actually materialized in each and every one of the employees or members that you cover, what would you do with this type of a treatment? And it's not a hypothetical question purely, and the reason I'm asking this question is that's what we've done at Virta Health. And here's a news clip from Politico a couple of months ago when we published our 1-year peer-reviewed results. And I'll just read this. A drug, of course Virta is a treatment, but they say a drug that reversed type 2 diabetes, eliminated insulin therapy, normalized blood sugar A1C, and in the process caused 30-pound weight loss, that would be the biggest blockbuster in history. So that's what the Virta treatment has delivered, and I will go into the clinical trial results in just a few minutes. But I thought it would be interesting to play a video from, actually just last week. This is a news clip from Indiana where one of our patients, Pat, whose treatment was covered by Purdue University, which is one of our enterprise partners, shares his experience in this TV clip. So I will be quiet and I'll just play this clip here.
The CDC reports that 100 million people in the U.S. are living with type 2 diabetes or prediabetes. Groups in Indiana are working with Virta Health to reverse the disease, and they are seeing some success with a special diet. Our Aaron Lish working for you this morning to find out what's being done. Aaron, good morning.
Good morning. Virta Health is actually working here in Indiana trying to reverse diabetes. We have one of the patients here, Pat Bailey, here with us. Now, we've been talking. You are off insulin now. You've been on the program for 110 days, and you were talking about a special app that you have. Can you just show us exactly what it is and how it works and how it's helped you?
Sure. The app is it's online. It's live. So basically, what they're asking for me is for daily measurements of weight, blood pressure, my glucose, ketones, and as we go through the thing, you see that the numbers, and those numbers are going right back to my health coach and right back to the online endocrinologist who monitor my daily activities. It's one of the things I really like about this program is because you've got constant support. You've got something that you're being kind of tied to the numbers, and I think that's probably one of the reasons why I've been so successful is because I kind of have this game with myself that I like to beat the numbers. I mean, I did it probably when I was taking insulin, and now that I'm off, I get excited about seeing a low number or a number in range because it means I'm doing the things I'm supposed to do to reverse this and make myself better for the future.
You were saying they look at the numbers, but they also ask you how you're feeling that day. They have the community that you can work with too on your app and everything. How has that worked for you?
Well, it's been great because I'm talking to somebody live as a health coach as I need them. So questions about a diet, questions about some kind of food that maybe I should or should not be eating, those questions are answered. The community's been great because it's kind of like the Facebook of community for Virta because it's people that are going through the same thing as I'm going through. So somebody finds a best practice, a best recipe, a best way to do something. You've got that access. I mean, the power in numbers is incredible.
And my last question I had to ask you, we're talking about how much this all costs. How much do you think this has ended up saving you?
It's saving me a couple $100 a month easy. I know it is. Just in supplies and insulin and co-pays and things like that. And so that starts to add up long term.
All right. Thank you so much. If you'd like to look into Virta Health and how this can work for you, we have that on the IndyChannel.com under the Hot Button tab. I'll send it back to you in the studio.
So that was Pat, one of our patients. It was interesting. He mentioned that he personally is saving hundreds of dollars a month, in addition to the fact that actually his employer or his wife's employer, if I know right, Purdue University, is covering the cost of the treatment. So he was talking about his co-pays exclusively. Another thing to point there is those results may sound one-off sort of miracle results that you have a person living with type 2 diabetes who's on insulin and gets off of insulin. Does that really happen across the board? As I'll go into the clinical trial results in a few minutes, yes, that is actually expected among most of our patients. But before going into the clinical trial results, I wanted to share a few questions that I've heard from benefits leaders and chief medical officers when I introduced Virta Health initially. Because when I say the word type 2 diabetes or treatment to address type 2 diabetes, I instantaneously get 2 or 3 questions, very skeptical questions. So I wanted to address those up front. Question number 1, oh my God, are you guys disease management? Because there's a bunch of articles in JAMA everywhere and 20 years of history. Disease management does not work, doesn't deliver much anything. It's absolutely true. However, this is why Virta takes diabetes and diabetes management to reversal, which is fundamentally a different outcome, both from an economic and health perspective. The second question I say, well, yeah, you talk about you have amazing results. Well, every healthcare company I've spoken with, or even a company that just has an app, they say, oh, we have proven clinical results. That's true as well. What I'd like to highlight and what I often say is there are very few companies that actually perform primary clinical trials and then publish or even are able to publish these results in peer-reviewed journals. That's what we've done at Virta. Anyone can treat a bunch of people and then create a pilot paper, a white paper. There's a whole different bar for integrity and data that you have to publish when it's peer-reviewed and in a clinical journal or scientific journal. And I'll share some of those results in a minute. Third question I hear is, well, even if you reverse type 2 diabetes, I have never seen an ROI in anything that relates to chronic disease management or diabetes. That might be true as well. However, when you reverse a disease that costs north of $10,000 per person per year, we've been able to show that we save almost $10,000 in the first 24 months per patient on average. And I should also add that these savings start in a matter of days, typically in under 30 days, because we can eliminate the costly medications, which is about half of these savings, really in the first 30 days, which you'll see in a second. And we only get paid for results. So it's not just a clinical trial, but when we work commercially, if we don't deliver those results, we don't get paid. Fourth question, well, maybe you have the wonder drug, but trust me, my members, my employees who are living with type 2 diabetes aren't really up for really doing anything, not even taking their drugs. We recognize that's a challenge. Practically speaking, we have been able to activate about 30% of the eligibles in under 12 months for a treatment that's pretty intensive. So we consider this as a very amazing accomplishment so far, and I'll explain a few things at the end how we do that. So yes, we can activate almost any kinds of populations, and now we've treated employees, Native Americans in a Native American tribe, and so forth. Next question I get, well, what if you only reverse the diabetes for a month or 3 months? No one has delivered long-term results. As you'll see in a second, we have actually data past 2 years, and we published 1-year results, which are outstanding. So our results actually improve at 1 year and are sustained past 2 years. Lastly, perhaps the most important question is, I just cannot increase my healthcare costs. All these disease management companies and tools and point solutions are just adding to my costs. In the case of Virta, that is absolutely not the case. We eliminate or replace existing diabetes and chronic disease-related costs. And as you will see in our clinical trial results, it's not only type 2 diabetes, but we can also either eliminate or reduce the cost of hypertension, obesity, and heart disease. And we typically get paid through the claims, so we are not an additional line item to the wellness budget. So now, those questions out of the way, which I usually get from anyone I mentioned Virta and diabetes, let's deep dive into our clinical trial results. First, there are all kinds of results. The one thing I want to highlight here is that practically everything I will show are peer-reviewed results published in scientific journals, and on this screen you see a handful of the manuscripts that have already been published around type 2 diabetes reversal, cardiovascular risk improvement, non-alcoholic fatty liver disease, and then also our long-term results. So these are real clinical trial results, not pilots or Virta's own studies and own data. First, as a highlight, we've now shown that, yes, we can reverse type 2 diabetes at scale. And specifically, at 1 year, 60% of our patients on the Virta treatment had type 2 diabetes reversed. And the definition for that is that these patients are off of diabetes-specific drugs, and their blood sugar is in a non-diabetic range. So effectively, they are treated and they're living like a person without type 2 diabetes. This is absolutely transformative. This compares to about 0.1% that Kaiser Permanente has shown in their long-term published results. Second point to highlight, while we reverse type 2 diabetes, we also reduced total cardiovascular risk. The 10-year cardiovascular risk, we've reduced 12% at 1 year on average. And all this happens while we eliminate medications, which from a payer's perspective is exciting because these are very easy to quantify and substantial cost savings. So on a population level, we've eliminated 54% of diabetes medications at 1 year. Again, published peer-reviewed results. And then lastly, diabetes reversal really translates into very substantial cost savings. So in medication savings, medication and pharma, I should say, medical costs and pharma savings alone, we save about $10,000 over 2 years per patient on average. So this includes successful and unsuccessful patients. So those are the headline figures. And then I'm going to briefly show you the very details of these specific areas. And again, if you have any questions, I see some questions coming up. You can click the Q&A in the Zoom, or you can email Julian Weiser, julian.weiser@virtahealth.com, and I'll answer as we go forward. So what I have here is the blood sugar change on the Virta treatment within the first year compared to the control arm. And what you can see is there's a rapid reduction in blood sugar and continued improvement from 70 days to 1 year, which is absolutely unheard of. And as I mentioned earlier, 60% of our patients at 1 year had diabetes reversed, which compares to about 0% without bariatric surgery. And this blood sugar comes down not because we pump more pharmaceuticals into our patients. By definition, when we reverse type 2 diabetes, we also get patients off of medications. So here is a curve of diabetes drug cost reductions. So what you can see here is in under 50 days, in fact, mostly under 30 days, the costs per patient come down about 50%. So this is annual average cost per patient of the diabetes drugs. Comes down very quickly. We can also show on a per drug class basis how quickly we can eliminate diabetes medications. What I have here is our clinical trial data on the right, and then our commercial patient data on the left. And there's two takeaways here. One, our commercial patients or commercial results are even better than the clinical trial, partially because we've improved our treatment and product over the last 3 years. And then a second thing to highlight here is, again, you can see that regardless of the pharmaceutical, the eliminations are very rapid, in 30 days, in 60 days. And so if you look at cost savings, and let's just say insulin, like the patient Pat in the news clip, you start seeing hundreds of dollars a month, sometimes even thousands of dollars a month of savings in under 30 days. Virta treatment is not a weight loss service per se, but this is a very highly desired positive side effect on the Virta treatment, that most of our patients lose a lot of weight. So what you can see here is at 1 year, the average weight loss is about 12 or almost 13%. And perhaps most impressively, there is no bounce back after 2 or 3 months or even 6 months, which is completely unheard of. And on average in our clinical trial, this translated into more than 30 pounds of weight loss per person at 1 year. And again, this is average, so half of our patients lost even more and obviously half less. And one of the last slides about clinical trial results, question is, well, how many people will stick to that? Well, the answer is very high number. 83% of our patients were still engaged and enrolled in the Virta treatment at 1 year in a clinical trial. And in our commercial populations, that seems to be better than 90%. So it's a very, very high engagement among our patients. And I'll explain later why that is the case, because it may be almost unbelievable. How is it possible that you have a treatment where you can have higher percentage of engagement than people simply taking a pill? also, I mentioned this earlier, the Virta treatment is focused on type 2 diabetes reversal, but the way we accomplish that is that we reverse the underlying cause of type 2 diabetes, which is insulin resistance. So we don't simply try to lower blood sugar, but we reverse the underlying cause, which is insulin resistance. And when we do that, it turns out we either improve or reverse 3 or 4 other chronic conditions. And I have here a few results from, again, peer-reviewed publications that we've already published. 60% of our patients who came with a clinical definition of dyslipidemia had that reversed. About quarter, or 24% of patients who came with high blood pressure, clinically elevated blood pressure, had it reversed. And then 1/3 of patients who came with a clinical definition of chronic inflammation had that reversed as well. I would challenge anyone to find a pharmaceutical that delivers these results in combination, because it does not exist today. So that completes this outcome section. So I've now talked about the type 2 diabetes epidemic and cost of it, and the fact that more than half of Americans have prediabetes or type 2 diabetes. Then I covered the peer-reviewed clinical trial results of the Virta treatment. And now I'm going to explain how does the Virta treatment work and what's the patient experience briefly. And then finally, we will go into how do we work with employers and health plans. So what is the Virta treatment? First of all, there are 2 components, and there's 2 areas of innovation that have enabled these results that we deliver. On the left-hand side, first is the technology platform that allows us to not just deliver telemedicine, but continuous remote care by licensed Virta physicians. And you may remember from the patient Pat in the news clip, he said, oh, I have this online endocrinologist. That is actually a full-time Virta employee. So we deliver continuous remote care in all 50 states by licensed full-time Virta physicians. So that's one part of it. The second part of the Virta treatment is a specific clinical protocol around medication management, particularly eliminating medication safely. But more importantly, the nutrition protocol that allows us to reverse insulin resistance. It's sort of A times B, or yin and yang. You have to have both of these 2 components, otherwise you can't deliver the results that we deliver. So let me explain the technology platform first. So effectively, we put our physicians and coaches into the pockets of our patients. The patient interacts with our physicians and coaches through the Virta app, through which we collect a number of metabolic health markers, blood sugar, blood ketones, weight, mood, energy, symptoms, and that sort of things. And then on a near real-time basis, we problem solve and try to understand what is the issue that the patient has, whether it's related to medications, nutrition, or something else. But the main idea is that the only thing the patient has to worry about is reporting the data to us and then performing the task in front of him or her. And they always have access to our clinical team. And they also have access to an optional patient community that provides support. So that's just very basics of the Virta continuous remote care platform. I mentioned that we deliver our care through our licensed Virta physicians. So you may wonder, how do we interface with the rest of the healthcare ecosystem? We are really a specialist, a metabolic health specialist. We do not replace the primary care providers. We communicate with the PCP of our patients. We inform when we've adjusted medications. We inform what kind of results the patients are seeing. And typically these primary care physicians become our best friends because we can reverse type 2 diabetes, in most cases in between the 3 or 6 month PCP visits. But integrating with PCPs is a key part of how we operate. And then I'm going to explain the second part. How does the Virta protocol work? And briefly, what's behind the nutrition protocol and how do we achieve nutritional ketosis? And I see a number of results coming in which I will, a number of questions coming in, which I will try to address in the next 1 or 2 minutes. Well, first, how does this protocol work? So, as I mentioned earlier, we collect number of biomarkers from our patients, and then based on those biomarkers, we either guide nutrition, medication, or complex behavioral issues. But the point is that every patient journey is different. It's different because they have a different metabolic background. They may have had diabetes for 2 decades or just diagnosed very recently. They are on different medications, and then they also have very different types of behavior issues. If you are a parent of a large family cooking at home versus a single person traveling a lot on the road, your nutrition and food needs might be very different. So everything in the Virta treatment and in our protocol is highly individualized. And then we repeat this process on a daily basis, sometimes number of times a day. We get information, we see if there's a problem, and then we guide the patient. So that's on a high level how the Virta protocol works. Nutritionally, you must be wondering, so what exactly do the patients eat? What do the patients eat that you can reverse insulin resistance? And I think I'm going to answer a couple of these questions that came in as part of this. Everything is highly individualized, but one thing that is common to all of our patients is we encourage carbohydrate restriction to achieve the state of nutritional ketosis. However, we do that in a highly individualized way. So if you are, for example, a vegetarian by religion, we don't ask you to start having bacon or eggs for breakfast. On the other hand, if you happen to love rice and you eat rice for, let's say, cultural reasons, we try to find sort of supplements, whether that's cauliflower rice or something else, that you can still maintain the nutrition changes and feel like you're getting the kind of food that you want. Also, we don't ship any food, so everything is education and behavior change based. And then what's counterintuitive to a lot of people is there is no calorie restriction. All of our patients, all the time, are encouraged to eat to satiety. And we also don't require any exercise, which is also very counterintuitive. And then lastly, we do have patients who reverse type 2 diabetes on a fast food diet. So yes, it is possible to be on the Virta treatment, reverse type 2 diabetes, and be successful while you only have access to convenience stores and fast food restaurants. So it's highly individualized. So there's one question here about, oh, I've heard of very low carbohydrate diets. Why can't I just do this on my own? Well, the answer is kind of twofold. One is, if you're a healthy person, you're not on diabetes medications, and you feel that you have all the capabilities, absolutely, you should go and change your diet for the better on your own. And if you can do that, that is absolutely fantastic. The second part of this answer is, for the great majority of patients, it's either impossible or unsafe to try to do this on their own. They need medical supervision to carefully de-prescribe the medications. And then secondly, nutritional ketosis is a very powerful tool, but it is very complex to get it right. Very few people actually see long-term successful results on their own. So if you're healthy, you're not the medications, you want to try a healthier diet and reduce carbohydrates, please go and do it. So that's Virta treatment briefly. And then there are a number of questions about the payment and how do we demonstrate medication reduction. So maybe I address the medication reductions, and I think there was one question higher up, and how do we get paid? So one question is, how do you guarantee that your enterprise customer would only pay for what works? So we actually look at results on a patient-by-patient basis. So if we don't get the blood sugar down to a non-diabetic level and also reduce medications, we don't get paid. So on an individual patient-by-patient basis, we report the results, and if we don't exceed what we call performance guarantees, we don't get paid. So it's a patient-by-patient basis. Another question is, how do we demonstrate the time when medications are being reduced or removed along the timeline with A1C improvements? Well, the earlier charts that I showed about medication reductions, how do we know that? Well, we know because we deliver continuous remote care, and we get the information from patients, and we tell patients when to reduce your medication. So we know exactly when medications are adjusted. And then, of course, for a claims-based analysis after the fact, we can see that what did the patients pay actually for their medication. So we have two types of data. One is what do we prescribe or deprescribe, and then the actual cost of medications. So we'll move on to the very last phase of this webinar before more questions and answers, which is how do we work with partners? Well, first of all, we do take patients directly. So if you or you have a family member or friend who's living with type 2 diabetes, anyone can go to the Virta Health website anytime and enroll as a patient or apply to enroll as a patient to the Virta clinic and Virta treatment. However, majority of our patients have the Virta treatment covered either by their health insurance company or their employer or other entity who is paying for the healthcare costs. And now we have partners throughout the country. We are live in all 50 states. And the populations range from, here's an example, Purdue University, which was one of our first enterprise partners, perhaps middle class to white collar population, to a Native American nation that we are working with, which I would say is more around middle class to lower middle class type of individuals. So there's very different types of entities we work with. There was a question around how do you guarantee that you only pay for what works? Again, we have one bundled fee per patient, and it's tied into actual outcomes. So if we don't deliver results, you know, in fact, I believe Virta should not exist. I started a company to really fundamentally fix the diabetes epidemic, and if we can't do that, we don't want to get paid. So that's really our economic model. How do we save and where do we save? There's 6 categories that I list here on this slide, 4 of which we've quantified. So I can't quantify the last 4 on the right, but the ones that we have quantified is medication reductions, which we can see easily, and it happens very quickly. Then you have emergency room and hospital visits, specialist visits, and then also other medical equipment such as, you know, tracking your blood glucose and so forth. These first 4 groups is the savings that I'm going to explain, and that's what we've quantified. Obviously, there are also savings around keeping employees at work because they don't have to have sick days, and then other workers' comp claims. We don't have data on that, and when we talk about ROI and the nearly $10,000 savings, that's not included. So that would be additional savings. So if we look at these first 4, we've now published a couple of results and presented in scientific conference the medication savings alone. On average, in our clinical trial population, we saved nearly $10,000 in the first 2 years. So what I have here is year 1 savings for patients not on Virta and then patients on Virta. This is a total healthcare cost. So the delta would be what we've saved. And then year 2 as well. And again, this only includes pharma savings and medical costs. Medical costs. This does not include what I would consider the softer savings, which could in some cases be even more valuable, particularly to an employer if you've had a lot of sick days among your workforce. I just got a question, do you do medication adherence? If so, how? The answer is we do not explicitly track medication adherence. So we don't do that. And I should say that on the Virta treatment, the focus is on getting patients off of medications. Virta is not about trying to send reminders to take your drugs. We try to restore your metabolic health, reverse insulin resistance, and consequently, for example, for someone with type 2 diabetes, when the blood sugar comes down, we have to, the safe and the right thing for our doctors to do is to de-prescribe medications. So it hasn't really been our focus, nor is it really useful for us to remind our patients to take their drugs on the Virta treatment. One of the last slides here, so how do we work with, when we work with an employer, for example, or even a Native American nation? Again, we have one bundled fee per patient once we enroll, and then it's tied into performance guarantees. And typically we contract through the TPA or the health plan, and then we use existing CPT codes to do the billing from the claims budget. So it's very, convenient for employers because you don't have to worry about the billing, you don't need additional budget, and we already have contracts with a number of large health plans, so the contracting, security, InfoSec, all these kinds of things have already been taken care of. So oftentimes, when we start working with an employer, if we have a contract with their insurance carrier already, it's just a matter of the employer saying, this makes sense, let's roll out, and then we can focus all the energies into how do we activate the employees or members, as opposed to security checking and budgeting and how do we do the billing. So that's how it works. And so then let's talk about briefly patient activation. When we started Virta, I was told that typically people can activate 5% or 10% of the eligibles. We've been now pretty nicely outperform that, and in the first 12 months, typically in our implementations, we've been able to activate about 30% of eligibles. And yes, we have nice marketing materials across all the different channels you can imagine, digital and offline, on-site events and so forth. But I think the number one reason why people living with type 2 diabetes want to sign up and take advantage of the Virta treatment is the results. So when we deliver the message and say, hey, did you know that diabetes can be reversed? Did you know that you could be safely off of your medications and continue living the life that you had before diabetes? Most people will raise their hand and say, that sounds too good to be true, but let me give it a try. And I think that's the main reason we've gotten these very high engagement results or activation results. So briefly, let me summarize here in 30 seconds and then answer some of the questions that are coming in. One, if there's one thing you remember from this presentation, it is that Virta is a diabetes reversal treatment. We are not about diabetes management. There's a couple of decades of history that diabetes management and disease management has delivered little or no results. We fundamentally can take people with type 2 diabetes, get them off the meds, and reverse the disease. Two, it's not just type 2 diabetes. As you saw from the clinical trial results, we can either improve or reverse a number of other conditions, obviously obesity, dyslipidemia, the underlying cause for heart disease, hypertension, and then also inflammation, which is obviously behind a number of other diseases from arthritis to psoriasis and so forth. Third, claims that we make are based on published peer-reviewed results. You can go to a website, download the actual papers. These are not pilot studies or our own internal white papers, but we actually run clinical trials to demonstrate that what we say actually is true. Three, Virta, although Pat in this news clip earlier talked about app, we are not just an app, we are not just a protocol, we are actually a online clinic where full-time licensed Virta doctors deliver care, and it all happens virtually. Point five, we are open in all 50 states. We have patients from all 50 states. Don't remember exactly if we have enterprise partners currently in all 50 states, but certainly they have employees and members in all 50 states. And then lastly, what we say we do, if we don't do that, we don't get paid. So this is really the economic model we use. And my personal hope is that most of the American healthcare would move towards that. You either deliver outcomes so you don't get paid as opposed to fee for service. So that's the Virta summary. And now let me try to answer these questions that are coming in. There's a question, do you contract with a specific Blue Cross Blue Shield plan? I believe we have certainly contracts with number of Blues plans. So we have, I think the answer is yes, but I would need to double check. There's also a question, what about people who live and work outside of the US? Legally, we have to establish the patient-physician relationship, although we practice telemedicine, initially when the person is in America. And that's what we've done with a number of people who actually work outside of US. So we can treat people who spend most of their time outside of US, but under the telemedicine laws, which we follow, the initial patient-physician relationship has to happen when the patient is in America. Then there's a question, can you go back to the cost savings bar chart to explain that again? So yes, here we are. So maybe slightly confusing. So year one, there's two bar charts here. On the left, you have an average person in our clinical trial living with type 2 diabetes, the total healthcare costs per year, so more than $15,000. And then the blue or the light blue bar shows what's the cost savings or reduction of total cost on Virta in year one. So you can see it's about $10,000. So there's $4,000 to $5,000 of savings within the first year. And then year two, it's a similar type of picture. It's 2-year cumulative cost of someone not on Virta, total healthcare costs versus the cost for the patient who is on Virta. So that's where the nearly $10,000 savings come per patient in the first 24 months. Then we have a question here, why would we not employ these practices for type 2 diabetics as well? Understanding that they will never be cured, but certainly you should be able to reduce insulin intake as well as other medical conditions like CVD, cardiovascular disease risk. It's a very, very good question. We have anecdotally seen phenomenal results among people living with type 1 diabetes. In fact, in our team of more than 100 Virta employees here in San Francisco, we have a couple of people who have type 1 diabetes, and they've seen phenomenal results. We at Virta as a company, when we take outside patients, however, we exclusively stick to inclusion and exclusion criteria that we've proven to be very successful in a formal clinical trial setting. So we have not run a clinical trial where we've treated people living with type 1 diabetes. That's the reason why we formally don't enroll people with type 1 diabetes. And one of our values is to be science and evidence-based, and we try to follow that to the letter. And since we haven't run a trial among type 1 diabetics, we haven't enrolled them. But anecdotally, we've seen phenomenal results, and patients have been able to reduce their insulin intake very substantially. There is a specific question about HSA accounts and is Virta eligible. We will follow up that specifically. Those are case by case. I don't want to make a sweeping statement how we address HSA with some of the employers that we work with. Then there's a question, what is the bundled fee? Well, first of all, the reason we say bundled fees, Virta is not a fee-for-service clinic. When we take a patient, there's one fee that covers everything we do with the patient. Our doctor's time, our coach's time, our app, our software, our entire team, and all the hardware we send to these patients. So monitors, strips, everything's covered. Nothing is added. So it's one fee, and then that fee is tied to outcomes. And if we don't deliver the outcomes, we don't get paid. And the fee is about $400 a month for the first year, and then less than that for the subsequent year. And then let's see if there's any other questions I did not answer. And again, I should say, let me go back to the final slide. If there's a question you don't feel comfortable asking here or me answering, feel free to email me directly, Sami@VirtaHealth, SAMI@VirtaHealth.com, as you can see on the slide. I'm more than happy to answer over email, have a call, come and meet with you or your team. There's nothing more important to me than responding to questions coming from potential enterprise partners or patients that we treat. So feel free to email me. Let's see how much time we have. It is 3:24 p.m. Eastern, 12:24 Pacific time. So I think we had scheduled an hour. So we'll hang in here for a few more minutes if there's any other questions coming in. Again, thank you so much for joining, and those of you who went through the entire presentation, I really appreciate your questions, and thank you for participating. I think we'll try to do this every month or so, and switch topics and do deep dives into different areas. And if you have suggestions of what kind of topics you'd like us to deep dive, send me an email and we'll try to make that kind of a webinar happen. Okay, so we'll wait for one more minute before we switch off. Again, if you have any follow-up questions to me, I'm CEO, co-founder of Virta Health, Sami Inkinen. You can see my email on the screen, Sami, SAMI@VirtaHealth. I'd be happy to answer questions later as well. Don't see any other questions coming in, so we will finish for the day. And again, thank you so much for joining. We will do many more of these webinars in the coming months. Please send me an email, and hopefully we're going to help you as well.